We're talking all things healthcare. We have Catherine CVA with AARP and Steve Edmonds with Alliance Insurance Services, as well as Laura Packard with Healthcare Voices here. Catherine, this person says, it's time for me to enroll in Medicare, but I plan to keep working. Can I enroll in a Medicare plan and drop my medical insurance at work?
You certainly can do that. And you can do it now, or you could do it during open season if you wanted to consider having it be your secondary plan. So you need to talk to your HR about that, whether or not it would be a credible secondary supplemental plan.
Laura, this person says, what income is the limit for Medicaid?
Well, Medicaid is a insurance program that's designed for low-income people and people with disabilities, and the income limits vary according to the size of your household. However, how Medicaid works right now is going to be different next year because the North Carolina legislature finally expanded Medicaid, which means many more low-income working families will be eligible for Medicaid insurance. However, the North Carolina legislature has not finished the job, and they are working on a budget now, and until that happens, this program has not been rolled out yet. So contact your legislators and tell them to get working on the budget. But the answer really is determined by your household and also whether Medicaid has been expanded or not.
Okay. Steve, this question is, please explain the donut hole.
Okay, so with Medicare coverage and Medicare drug coverage, you have 3 stages. You have your initial coverage phase. That's when you just simply pay your copays. And that goes until the cost of your drugs has reached $4,660, $4,660. Now that's a combination of what you pay as a copay plus what the insurance company pays. So it's a combo of both of those amounts. When you've reached the donut hole from $4,660 up to $7,400. So anything in that little time frame there is the donut hole. And when you reach the donut hole, it's nothing to freak out about. It's okay. You're still in coverage. It's just that you're going to be asked to pay a little bit more. Your copays are going to go up some, but you're still going to have coverage in the donut hole. Then after you surpass $7,400, you reach what we call a catastrophic phase, and then your copays go way down at that point. So there's 3 levels: initial coverage, donut hole, catastrophic.
Gotcha. Okay. Catherine, this person says, how does TRICARE for Life impact Medicare?
So once you go on enroll in Medicare, if you have TRICARE for Life, it begins to act like a supplement. So you would not need to go out and get another supplement for your secondary or for the coverage gap between Medicare and the 20% that they don't cover.
This person's asking, do you still have to sign up for Medicare at 65 if you have an HSA? Steve?
Yes, absolutely.
There's nothing that tells you at any point that you should not sign up for Medicare at 65. You should sign up for Medicare at 65. You can defer some things, but you should sign up. All right, Catherine, this person says, if I'm on Medicare, do I have to continue to sign up during open enrollment, or does it just roll over?
It does roll over. If you're satisfied with the coverage you have, you don't have to do anything. However, you may want to look at your supplement to make sure it's still the right one for you.
Okay, and really quickly, we have under a minute. Laura, for those who are on that Medicaid unwinding, tell us again what they need to do.
If you have been kicked off of Medicaid, contact your Medicaid office and challenge it if you think you're still eligible. And if not, go to healthcare.gov and sign up for affordable health insurance through the ACA.
Okay, and of course, we will have all of you back again as we get closer to enrollment because there's lots of people asking lots of questions. Thank you for your time and your expertise. If you missed any of this, head to WFMYnews2.com. It'll be in the 2 Wants to Know section.